Please note that the following episode contains material of sensitive nature, including self-harm. If you or someone you know is struggling or in crisis, help is available. Call or text 988 to get 24/7 support. You may also visit your local emergency room.
Welcome to Illuminating Health, the UCSF School of Nursing's podcast that sheds light on health and healthcare issues affecting our daily lives. My name is Kira Prokopakis. I'm a longtime labor and delivery nurse and current student of the Psychiatric Mental Health Nurse Practitioner specialty. And today I'm joined by Kara Birch, Associate Professor, and Jane Abanis, Assistant Professor. Thank you both for joining today's episode.
Thanks for having me.
Thanks for having me.
Kara and Jane are leading efforts to improve access to psychiatric care by offering these services within a community-based OBGYN clinic in San Francisco. Kara, please tell us how this work came about.
Yeah, thanks, Kira. It's a great question. So how this initially started was one of our UCSF community partners, Golden Gate OBGYN, had really identified a need for improving access to mental health services for their patients in their practice. And it's a large OBGYN practice with nurse practitioners and physician OBGYNs. And oftentimes they were identifying patients really struggling with mental health symptoms, but their patients were experiencing what most folks in the United States experience, long wait times in the community for mental health. And they really had no way to ensure patients were able to get the services they needed. So oftentimes patients went untreated and then they would return to the provider struggling with the same symptoms at the next visit. So they reached out to UCSF School of Nursing, which has a really long-standing psychiatric nurse practitioner program, and we began collaborating. So that's when I stepped in as faculty to lead the partnership and develop the project. We began to develop mental health screening and intervention protocols with the team. And in 2022, we launched integrated mental health services at the practice with a psychologist, a psych NP, and a navigator with the aim of really meeting the needs of the individuals in the practice across the lifespan. So helping folks with everything from anxiety in the transition to college to menopausal depression and just the whole gamut of mental health issues to really be able to support patients in the practice.
Sounds like a really thoughtful response to a chronic need in the community. Jane, what is a typical day like for you at Golden Gate OBGYN?
So my day varies, so it depends on how many patients I have at the clinic that day. But on a busy day, I have about maybe 6 patients a day, and perhaps half of those are new patients and half are follow-up appointments for medication management. And I mainly do telepsychiatry, so the beginning of my day really sort of making sure that my technology is working, that I have my Zoom in place. Many of my new patients are new to technology themselves, and some of them have not been in telepsychiatry. So, I do interviews certainly, and during the beginning of my interview, I make sure that they're in a private location. So we talk about privacy, we talk about safety a lot at the beginning, and certainly making sure that these things are confidential given the nature of our telepsych appointment. So the beginning really is just getting to know the patient, establishing that rapport. And certainly, as we progress in the interview, we talk about the struggles that the patients are going through, whether it be perinatal, in their perinatal period, or postpartum period, or even menopausal period. So we talk a lot about psychoeducation in our appointment visits. And only then will I consider perhaps if they're considering therapy or medication management in the treatment process. And this is really patient driven. We talk a lot about patient centered care a lot. And this is where, in this practice, I feel like this is where this concept is really implemented, in my opinion, because some of them are not ready for medication. So they might return to me a week or two later, really wanting to discuss more or being ready. So we talk a lot about psychoeducation, about medications, or even therapy. And at the end of the day, I certainly have to make time to do notes, which is a lot in psychiatry sometimes. And I prescribe medications online, so which is a really cool thing.
So great that you are prioritizing patient-centered care and making medication, therapy, all of it continued conversation that you're having with the patient. Kara, anything you'd like to add?
Yeah, I mean, I think one of the beautiful things about our typical day is that we really get to partner with patients wherever they're at in their life. We have patients come on the screen with their newborn, that they're holding and spitting up on them. And, ideally someone else is taking care of the baby, but not always, right? Or we have folks that show up in tears or anxious, and we get to kind of partner with them and really share in the human experience. It's okay. There are supports, there is help. People do get better.
What a privilege to be able to meet a patient where they're at. I heard you touching on what a lot of people experience postpartum, which is postpartum depression. Can you tell us what that is?
Yeah, thanks for asking that, Kira. Having a child is a major life transition, and it can lead to a wide range of emotions, right? It's stressful to be woken up by a baby multiple times a night, and most parents experience anxiety, fatigue, maybe grief over losses of freedom and role transitions. But it was surprising to me. I remember when I learned that mental health conditions are one of the leading causes of maternal morbidity and mortality. And postpartum depression is the most common complication of childbearing. So we often think of things like hemorrhage and other very important medical crises that can happen, but we often don't put enough emphasis on preventing and treating mental health conditions in pregnancy and postpartum. And about 1 in 5 women and 1 in 10 men experience depression during the perinatal period. And oftentimes individuals don't report their symptoms. So while there might be a wide range of symptoms, with postpartum depression, feelings of low mood are persistent, and they can include feeling irritable, sad, hopeless, feeling really guilty or bad about yourself. Some folks will say they have a sense of not being able to connect or enjoy things, including potentially their baby. Some people will withdraw or have trouble sleeping, have trouble with their appetite, or thoughts of hurting themselves or someone else, including their infant. And I think it's important to point out that postpartum anxiety is a real thing as well. And about 20% of people will develop perinatal anxiety. So it's really vulnerable to be caring for a helpless new life. But for some people, the anxiety can begin to interfere with their ability to rest, to concentrate, to slow down their thoughts, make decisions. They may feel worried most of the time, or like something bad is going to happen. And anxiety can often result in physical symptoms, headaches, stomach aches, physical tension, and can also lead to panic attacks as well. So folks can have both depression and anxiety, or they can have one or the other.
Thank you for that amazing explanation of what postpartum anxiety and depression is. For patients who are experiencing these symptoms, what challenges do they face in accessing psychiatric care?
And this is not going to be an all-encompassing experience that our clients struggle with in the clinic. However, I think I would categorize it to 3 different things. One would be stigma associated with seeking care during the postpartum period. Secondly, access to care for some of our women. And also, there's potential costs that may be associated with seeking mental health care. As Kara touched on, they're a new mom prior perhaps to the birth of the child. They're very excited to go through the motherhood experience, and all of a sudden they have sort of mixed emotions with their baby, having had to go through perhaps even a difficult pregnancy and a difficult delivery. So perhaps mixed emotions are happening within our patients. So I think stigma is potentially a considered problem among new moms. They have concerns that they're not good mothers and may struggle with feelings of inadequacy, or they may fear that seeking help is a sign of weakness for some of the mothers that we have, and also concerns of potential effects of potential treatments that we may have for them in the clinic, whether it be depression or even therapy. Sometimes therapy requires a lot of work, requires a lot of time for the moms to go through, meaning they have to be there weekly and away from their babies. So a lot of guilt associated with potentially being away from their babies as well. I mentioned access to care. I had a mother before who had waited months to get mental health care as a new mom. And then when she was plugged in with our clinic, she was just elated that we have this team that would potentially help her go through some of the symptoms that she had been experiencing. And cost. Therapy sometimes could be very pricey, even though the insurance potentially would cover some of the treatments and therapy. There are times when insurance can only cover so much, and yet they still struggle with some of the symptoms that they're experiencing. So they stop treatment. So I think these are the three areas where potentially our patients may struggle with seeking care for postpartum depression and other mental health problems.
What a tough thing for sleep deprived new parents to have to go through on top of caring for a new infant. How does the model you're leading at Golden Gate OBGYN address these barriers?
Yeah, it's really interesting, when you think about it too, like even before someone is considering conceiving, right? They go to their GYN and are often seen. The idea, when we talk about access in particular, that you have someone that you are seeing and we can identify that you're having some struggles and some symptoms early, right? Then we're enhancing access before there's even a potential baby in the picture. And I think that that's huge, right? If we can meet folks where they are at in their medical settings, that they're coming in for something else. Maybe they're coming in because their periods are irregular or some other issue that's happening, but we can also help prevent potential, worsening symptoms of mental health. And I just think it's, when we think about an integrated model, like it's a terrible thing to feel terrible, to be brave enough to like admit to someone that you feel terrible, right? And then to be like, yes, you do in fact feel terrible, and it's going to take forever for you to be able to get help, and call your insurance company and see who you might be able to see that you could afford, that your insurance might cover a percentage of. Like, that's a nightmare when you're already feeling awful. And so I think that our team and Golden Gate's, kind of deep belief in the importance of this work meant that they were willing to train their staff and their providers on a new way of viewing mental health and new ways of providing care. And so patients don't have to worry about, how do I figure out these long wait times, or how do I figure out who's on my insurance? We kind of hold their hand on the journey and make sure that they get the support that they need when they need it. And I really think that one of the drivers of success in our program is the staff. They help to follow up. They ensure that those who are struggling are seen quickly for a visit, connected with resources. They have what they need, from lactation consultants with availability to therapists specializing in things like infant loss, and really help to support people on their journey to find some healing and to help them with the suffering they're experiencing. So it's access at a lot of levels, right? Like it's this early detection, early intervention, potential prevention, and then quickly advocating and helping to treat and improve symptoms.
I love this model, and I feel so happy that this resource is available to get people connected when they need immediate help, especially in a high risk time such as the postpartum period, but also before there's even a pregnancy, really operating at a preventative care level. What has been a highlight of this work for you?
I like this question. So prior to a year ago, when I started here at the clinic, I was treating service members in the military. I was an active duty service member military for over 26 years. and I had treated mainly service members with combat-related PTSD. So when when something like this came up last year and they asked me, "Do you want to go to this clinic where we treat mainly women?" I was just really kind of both ecstatic and really scared because it's not an experience that I had when I was in the military. Not a whole lot anyway. I had some postpartum depression experience and things like that, but it was really out of my comfort zone. But I took a leap of faith, and I think one of the highlights for me is that deep connection that I experience with the patients that we have in the clinic. You know, as a woman myself, also a mother, and had a really demanding career. Then as a military service member, and also now as a professor at UCSF, I have this deep connection of what they experience as women, whether it be kind of looking back at my experiences as a mother, when I had small babies running around and having my career and going to school full time. And also, we didn't really touch on a lot about women experiencing menopausal problems, but as I listen to my patients talk about their experiences, I learn from them as much as they learn from me. And it's kind of a scary thing to look forward to some of these symptoms, but also it's given me a gift um, of learning from my patients. So it's I love this work, and I can't really just say enough about how I enjoy my clients.
Yeah, so beautiful. Yeah, I feel in a lot of ways similar to you, Jane. I just think it's a gift to be able to be invited into someone's story, the story of their life, and to share the sense of humanity and really witnessing people's suffering, but also really witnessing their resilience and strength. And the thing I remind my patients, and when people ask, like, how do you stay in this work without getting burnt out? And um, I always say people get better, right? Like, that's the beauty of this work, is that people often see us on kind of a period of their life when they're going through some of the hardest things, and they start to kind of see some light and see things shift and find some hope or feel more settled. And that's really a huge gift to be able to witness that.
Thank you so much for sharing, both of you. As an OB nurse, I have heard firsthand from my patients about how hard it can be to find a mental health provider in the community. What is your advice to healthcare providers who are listening and are interested in starting a care model like this?
Email us, call us, reach out. I don't know. I've been doing integrated care work for about a decade, and I've learned a lot from my own mishaps and struggles along the way. Um, but I don't know. The first thing I say really is to do your research, know what models are out there, the evidence for the models, and to really assess what is the need. We may have a great idea and there's not a need for it, or we don't fully understand the needs. So knowing the population we're working with, knowing the clinic we're working with, really, really doing our homework and an assessment of the need first. And the other thing I think is really collaborating. I don't think we're meant to do this work alone. It requires a lot of communication, a lot of collaboration. I think one of the great things about this practice and about Golden Gate is they were so open to learning and to listening to us interprofessionally, to really valuing the expertise in the room of different professions, and really allowed us to work together as a team, and to us to be able to lead from our expertise and them to be able to lead from theirs. And then I think it's an ongoing process of really continuously improving it. Like, if something isn't working, it needs to shift. We have to assess how things are going, get feedback from our patients, get feedback from our staff, from other providers, and really listen to that feedback and make improvements to improve access, to improve outcomes, all the things that we're trying to track and measure to make sure that we are actually making an impact and a meaningful impact. And your patients often can tell you a lot about how it's going and their perspective. And so really listening to all the stakeholders involved in any kind of project like this.
I'd love to see this kind of integrative care model gain traction. I appreciate you both showing us what is possible with truly collaborative care. Thank you, Kara and Jane, for joining us on this episode of Illuminating Health. And thank you to our listeners. We look forward to connecting with you next time.